I'll never forget that first time I went into the bathroom. I washed my hands and I looked up and looked in the mirror. And I was mortified. Mortified. I'm sure you can tell that the right side of my face doesn't work the same as my left. A lot better than it did then. It was 100% paralyzed. Blood just
You look
matted
great,
in my
by the
hair.
way. By the way, you carry yourself so well. You look great. You sound great. It's incredible what you've overcome. So
Well, thank you.
that's all I
Thank
have
you.
to
It's
say about that.
I'm a very tenacious person. I was just devastated and I cried and cried. And the realization was there. It wasn't just I can feel it. I have people telling me these things. I looked in the mirror, I could see it. And I still had dried blood under my fingernails, just matted in my hair. And I just looked a horror and straight out of a horror film. And the trauma doctor who recognized that he felt like my facial nerve was severed came to me, and I guess it was on the third day morning. And he said, I found a physician at Barnes, which is Washington University in St. Louis, who is willing to do a nerve transfer and try to reconnect to your facial nerve. And I was like, oh my God, I didn't know that was possible. So then I got transferred there. I had a very extensive surgery where I had grafts taken from the back of my head. They retrieved the nerve. They had to go through my mastoid bone that's missing in the back here. Reconnected my nerve. And they said, we don't know if it'll work. It's a 50-50 chance. We'll see. And I said, it's going to work.
Did it work?
Yeah, considering this whole side of my face did not work, I'm like, I was talking like this. Anyone with Bell's palsy that you've ever seen, I would say it's about 50% recovered, but it's enough that I want to say it's enough that I'm happy with it. I'm not. But that was just one of the many injuries that I sustained. I don't see well out of my right eye anymore. I have a weight in my right eyelid just to make sure that it closes. Chronic migraines, chronic pain. A portion of my sternocleidomastoid was severed. So it's difficult for me to move my head, or there's a lot, but the hardest part really was just the psychological and emotional recovery.
Where does your mind
Very
go during this to stay hopeful and positive? For you specifically, what kept you afloat?
pure will and determination and love for myself.
Was there an outright stubbornness during it all? Like, I'm not going to let this biatch, part of my French, bring me down,
Well,
or this attacker, I should probably have said attacker. Sometimes a dose of ego is helpful. When the weight of life is on your shoulders, sometimes a little dash of ego does help.
indeed.
Yeah.
Yeah. For instance, when the patient pushed me to the floor so she couldn't stab me again, I thought she got me to the floor. So I refused to let my head hit the floor. So no, you're not getting me down. Some of it is that, yeah, I've just always been a very tenacious person. If you say I can't, I will show you I will, and I'll do it better than anyone else. That's just the kind of person I've always been. But it's interesting that you ask that because it's a much deeper conversation. I don't even know if we would have time to go into it all today,
Probably
but
not, but some echoes
I
of it.
was, yeah,
That's what I do, Tammy. I
it
take
was
a
a really,
conversation and I derail it in a whole different direction. No, I won't do that.
that's okay. You know, I have that ADD ER nurse I can track.
No,
Um,
I've been through a few things and I just know, and genuinely curious when you're at rock
yeah, it
bottom.
really